And we're just waiting for it to connect. Okay. We should see here. Okay, amazing. All right, guys, we're going to get started in the next 30 seconds. Just going to wait for everybody to tune in and jump in. In the meantime, before we get started, my name is Alex Ruiz. I am the Director of Content and Community here at Paloma Health, where we specialize in Hashimoto's and hypothyroidism. So what makes us different at Paloma Health is, we are more than just a testing kit company, which we offer. We are a full online medical practice, meaning that providers like Dr. Zager here, that is going to be joining us for our May office hours, can see you from the comfort of your own home. We can, request labs, we can medication refills. And here at Paloma, we really try to focus on a full body approach. Obviously, every person is different. They're going to have a different treatment plan, treatment style, preferences with their doctors. So we really just focus on trying to make you feel the best that we can and optimizing your thyroid at the same time. We also have a mobile app, which is really exciting. It includes so many different features, such as, an AIP course, if that's something that you're navigating through to help reduce inflammation. We also have some workouts and meditations to help with stress management. And one of our biggest features that we have in the app is our symptom tracking, which is really helpful. So you can get an idea of what your daily symptoms are like. On a daily basis, it might be hard to kind of understand what your energy is, but when you're tracking it and then you're able to kind of take a step back and realize, oh, wow, my energy actually has increased this past month. That's really exciting to see that you're making progress, because at the end of the day, small wins are just as important as big wins. So that's us here at Paloma. If you have any other questions or would like to learn more about us, you can head to our website at palomahealth.com. We have a bunch of different resources, guides, blogs, all the things that you can refer to for more education. And without further ado, we have Dr. Zager here. We're going to go ahead and get started. He's going to be joining us for our May office hours. And as I mentioned earlier, he is one of our providers here at Paloma. So you can actually, depending on your state and where you're located, see him as a patient. And I'll go ahead and let him introduce himself, and we'll get started with our office hours. So without further ado, Dr. Zager.
All right. Hi there, everybody. My name is Sean Zager. I'm a family physician. I live and work out of Ann Arbor, Michigan, which is where I'm from. I do a ton of thyroid care. I really enjoy doing thyroid care quite a bit because I think it lends itself well to a holistic approach, in that there's a lot of good conventional inside the box ways of approaching thyroid care, but also good outside the box ways as well. And certainly not a one size fits all kind of approach. So it's really nice to help people understand their options. And it's also very satisfying to see people's thyroid care optimized after often a long time of not. So that's my brief intro, and I guess we're getting started here. I see a question here. If I take natural desiccated thyroid, is it better to take it all in the morning or split the dose? So I think that the answer is it depends. Most patients take natural desiccated thyroid all together in the morning. They seem to get high yield that way, and they do quite well taking it all in the morning. That said, there are some examples where patients find that the effect wanes in the afternoon, and they do better splitting the dose half and half and taking the second dose usually early afternoon, a few hours after lunch, obviously wanting to separate it from meals by at least a couple of hours. I see another question here. If TSH is on the low side, like 0.3, 0.4, but free T4 and free T3 are optimal and in range, and there are no signs of hyperthyroidism or over medication, can the thyroid patient continue at that dose safely? So, that's certainly, I'm certainly a doctor who pays attention to TSH. I know there are other doctors out there that don't think that TSH is important. I do, in concert with the other labs like free T3 and free T4, like you mentioned. I would really have to see the exact values of the free T3 and free T4 to answer that question exactly. With the TSH being at 0.3 or 0.4, like you mentioned there, that's borderline. Some labs call that low, some labs call that normal, so it's kind of a low normal state. So I would say, again, with a little bit of a limited appreciation of the other lab values, which would be important to me, that's something that I would want to track and repeat labs at a certain interval to make sure that it's, to appreciate how those numbers are trending. And I would not want to say that TSH trending down. If it was, I would want to decrease thyroid medication. Next question. Is there any new and exciting research in the understanding and treatment for autoimmune thyroid conditions that we should be aware of? Any new and exciting research? Well, you know, for autoimmune thyroid conditions, my approach is first and foremost lifestyle support, specifically talking to patients about the AIP diet, which there has been some limited research on for Hashimoto's. I don't know of any new research on that, but also talking about other life self-care aspects like exercise and stress reduction. With my patients also, along with those measures, I think about low-dose naltrexone, which I won't launch into here and now in detail, but there has been a lot of research on low-dose naltrexone for various autoimmune conditions, although not much for Hashimoto's. I'm going to go to the next question here. Can the TPO levels in a Hashimoto patient whose TSH level is normal ever be at 0? Or will they always have some TPO elevation, perhaps to a lesser degree than when there is a flare going on? Hold on. As my TSH normalized, I still have lesser extent running. Okay, so this patient is wondering about TPO trends even when TSH is normalized. And it's a good question. Most labs will call a normal TPO antibody below 30, although I've seen some labs say normal is below 60 and some labs say normal is below 16 and some labs say normal is below 9. So there's definitely a range there, which, but to answer this question, you know, very specifically, it's rare that I see a TPO level at 0. So, you know, having some small degree of TPO antibodies around is considered normal by lab values. In my mind, as long as it's low and into the normal range and the TSH is normalized and people are feeling well, I call that optimized care. Next question. I would like to know why TSH diminishes while free T3 and free T4 stay in range while taking Cytomel. Well, so I mean, that is so typically when TSH is going down, free T3 and or free T4 will typically go up, but those trends are not always in a linear or opposite fashion always. And it depends. I mean, typically in this case with Cytomel on board, you'd expect free T3 to go up. And oftentimes we see free T4 go down a bit. So in your case, why it's not doing that, I'm not sure. I would probably, again, you know, kind of harkening back to a previous question, I really don't like to make too much out of one data point or one set of data. I would have your provider kind of follow trends in those numbers and those levels. And I think over time, I would expect to see free T3 increase with Cytomel on board. All right, next question. Do you believe reverse T3 is an important marker? Why or why not? Yeah, so I do. I would say I don't use it with all patients, but especially if I'm wanting to better understand how a patient's converting from T4 to T3 in their bodies, I do like to follow reverse T3. The studies on this are mixed, but in my experience, I find it to be a good proxy for how patients are converting from T4 to T3 and what their T3 medication needs and T4 medication needs might be. So I often do follow it if I'm considering T3 medication as part of a patient's care. All right, next question. Why is it important to take your thyroid medication on an empty stomach? I mean, that's an easy one. when you take it with food or often beverages besides water, other meds and supplements, it really inhibits the absorption of the medication so that your body isn't able to utilize it as well as if you took it on an empty stomach. All right, if iodine levels have been tested and are a little bit low, but taking iodine supplements makes the thyroid inflame, neck hurt, fatigue, etc., is there any way to help bring up iodine levels without causing a flare-up in a patient with Hashimoto's? Okay, so in a case like this, you might consider, instead of iodine, so let me start first by saying, I think it's very important in these cases to test iodine because the majority of patients in this country are not iodine deficient. And I think that some patients take iodine unnecessarily, which can cause harm to the thyroid gland and thyroid function. So I think it's important to monitor if you are supplementing with iodine. But in this case, if iodine supplements are causing untoward symptoms, you might consider trying to get more iodine through the diet, using iodized salt or seaweed, kelp extracts, that type of thing. You might find it more easy to tolerate than straight iodine supplementation. After a total thyroidectomy, does Hashimoto's completely go away? I read that some people can also have Hashimoto's and have negative antibodies. I don't know what's meant by negative antibodies in this case, but maybe you mean just harmful antibodies. So after total thyroidectomy, you would think that with the thyroid completely gone, that there would not be antibodies against it. I will say that I do see patients that still have antibody levels that are elevated after a total thyroidectomy. I'm not quite sure what the disease process there is, but I imagine that there might be either some tissue left behind that is the body is able still to attack, or there are just other circulating TPO antibodies in the bloodstream, even if the thyroid is gone. I will say that I do see that sometimes. Can you explain who would be a good candidate to use a natural desiccated thyroid medication? Okay. So this would be a patient who would benefit from T3 medication because natural desiccated thyroid, for those, I'm sure most people seeing this know, but it is a desiccated porcine or pig thyroid gland that includes proportion of T4 and T3. So some patients just really do well with the ratio of T4 to T3 found naturally in the pig thyroid gland. And so patients who would benefit from T3 medication could very likely benefit from natural desiccated thyroid medication. There are forms of natural desiccated thyroid medication that are very clean. Most are. I tend to use NP thyroid. It is very clean. And it's interesting. I'll say too, before I move on to the next question, that some patients with Hashimoto seem to do very well with natural desiccated thyroid. And then there are other patients with Hashimoto's that don't do well with it. But it can be worth a try and following how patients' symptoms change and how numbers change as well. Okay. Do you recommend getting off birth control to help my hypothyroidism? Can that help improve my thyroid hormones? Oh, while these hormones do certainly interact and communicate, I haven't found extra challenge in managing hypothyroidism in patients who take oral contraceptives. So it hasn't been something that I felt very strongly about. I guess I'll just say that. I would need to know more about symptomatology and also maybe perhaps see numbers and how numbers are trending to answer that more specifically, but not something that I typically have a strong feeling about. If I put my Hashimoto's into remission, will I still need to take thyroid medication? So that depends. So saying Hashimoto's into remission, meaning the antibody levels are down into the normal range, it still may be true that your other thyroid function tests like TSH and free T3 and free T4 are not in the normal range off of thyroid medication, meaning that you might still need thyroid medication even if Hashimoto's is in remission. Let's see. What else can patients do if they don't want to be on medication? So it depends. I would have a different answer for that if patients were for Hashimoto's versus non-Hashimoto's patients. But just in broad strokes, there's no doubt that lifestyle considerations are important. Eating well, eating an anti-inflammatory diet, perhaps an autoimmune protocol diet if you have Hashimoto's, regular exercise, good stress management, good quality sleep. There are some supplements that can certainly be helpful. The Paloma supplement is a good example, which contains selenium, which is a classic for thyroid support. So that's something to consider as well. Next question, what are your thoughts on mold exposure and hypothyroidism / Hashimoto's? Root cause? Yeah, I'll say I'm really not an expert on mold exposure. It's outside of my expertise. So I think I'll just pass on that question and direct you to your primary care doctor to answer that further. Why is going gluten-free recommended? Like, why gluten? Okay. So that is recommended. Well, it can be helpful for many different people with many different inflammatory conditions. I've seen over and over again, it'd be helpful in particular with patients with Hashimoto's, which is, of course, an autoimmune condition. There's something about gluten, and I will say I see it more in this country. So I don't know if it is the specific gluten protein or if it's the way that gluten is processed, hybridized, made in its components in this country. But it certainly in this country is inflammatory for many people, especially those with autoimmune disease, along with other food components like dairy and sugar. I mean, gluten, dairy, and sugar are the three most common inflammers in those with autoimmune disease. So but gluten is maybe, in my experience, the most common. So I see over and over again that when people go on a gluten-free diet, they feel better and their lab tests look better. What else can patients do if they don't want to be on medication? I think I just answered that, so I'll wait for the next question. Okay. How can I reduce my goiter? So it depends what the cause of the goiter is, but typically if there is a goiter, it often is surgical, truly. Sometimes we use radioactive ablation of the goiter, but I don't know of any medication or herbal protocols to help a goiter resolve. Can you share some tips to reduce antibodies? Okay, so we're having a lot of questions about Hashimoto's and antibodies, and so I'm going to answer this. It might be a little bit redundant or repetitive, but it's good to kind of drive these ideas home because they're very important. I talk about these every day with patients. To reduce antibodies. So antibodies are, talking about thyroid antibodies, are a reflection of autoimmune thyroid disease. And that is the body attacking your own thyroid tissue, which over time can degrade thyroid function. So to reduce those antibodies, or to say to reduce the autoimmunity or improve immune regulation, the first kind of ground floor where the rubber meets the road recommendation is around lifestyle, which is harder to do because it's habit change than just take a medicine. But it really seems to be the most effective and sustainable way to reduce antibodies and autoimmunity. And specifically, that would be like the autoimmune protocol diet, considering eliminating foods like gluten, dairy, and sugar, like I just mentioned, regular aerobic exercise, stress management, good quality sleep. And then once my patients are really doing their best to meet those goals, if needed, I do consider low-dose naltrexone as an option as well, which can help to reduce antibodies along with those good self-care measures. How do I know if I have primary or secondary hypothyroidism? Some people say Hashimoto. Okay. Okay, these are separate questions. Okay, so how do I know if I have primary or secondary hypothyroidism? So this can be a very long answer that gets into the nitty-gritty of endocrinology. I'll try to answer it briefly. basically, so primary hypothyroidism is a dysfunction in the thyroid gland itself, which is what we're talking about here, and what the only thing that we manage at Paloma. A secondary hypothyroidism would be a hypothyroid state secondary to another disease state. Most commonly, that is from pituitary dysfunction. When this is the case, we see low levels of TSH and thyroid hormones across the board. And when we see that at Paloma, we refer to endocrinology because we really don't manage that here. Some people say Hashimoto's is more of an immune system problem rather than a thyroid problem. What are your thoughts? Yeah, I would agree with that. I think that in its essence, Hashimoto's is an immune system problem. It's an autoimmune problem, again, where your body's immune system is attacking your own thyroid tissue, which is what then causes a thyroid problem over time. So I would just say I agree with that concept. Do you think it's important to look at cortisol levels if your Hashimoto's is not getting better, meaning you're still symptomatic, even though the numbers look good and treatment is being done with a T3, T4 combo? Yeah, I mean, I would need to know a little more about what's meant by still symptomatic in that case, and kind of what the exact constellation of symptoms is to really point in the next direction. But certainly looking at adrenal function, if the numbers are all looking good and it seems like thyroid medication is really optimized and there's still other symptoms, you might look elsewhere. To be clear, you might look at other formulations of thyroid medication. There are still other nuances that could potentially be addressed within thyroid care, but certainly looking at adrenal function as it relates to thyroid function could be a reasonable option as a next step. What are your risks associated with TSH suppression-based thyroid management? Yes, so I see this sometimes, and I certainly am a physician who does not support chronic TSH suppression, and that is the general thought here at Paloma. You're asking what are the risks? The risks are very clear, and I see them. They're not just theoretical. I've seen them over and over again. In an acute setting, patients often feel restless, agitated, sometimes anxious, with sleep disturbance that can often lead to symptoms that people mistake for hypothyroidism, even though it really is from a medication-induced hyperthyroid state leading to that TSH suppression. Things like fatigue, hair loss, those things can be seen with the medication-induced hyperthyroidism that leads to the TSH suppression. In a long-term sense, we see decreases in bone mineral density, which would be increased risk for osteopenia and osteoporosis, and also the development of arrhythmias, heart beat abnormalities like atrial fibrillation. I've seen one patient who had chronic TSH suppression, developed atrial fibrillation, and then had a stroke because of it. So the risks are very real. Does my thyroid medication affect my diabetes insulin medication? That's a good question. I don't imagine so. I mean, if you were very undertreated for your hypothyroidism and your metabolism was very sluggish, it may be that you are not metabolizing blood sugar as quickly, and it may affect your need for insulin medication. So in that sense, there could be some interaction. Certainly all these hormones do talk to each other. But if your thyroid medication formulation and dosing are pretty well optimized, I don't think it should affect your insulin medication negatively. Is Hashimoto's or hypothyroidism hereditary? The answer is it certainly can be. We do see that quite often. All right. And I guess that was the last question. So thanks, everybody.
Hi, guys. Thanks so much, Dr. Zager, for all of that. Lots of questions. Seems like antibodies was the theme of the night.
Yeah. Absolutely.
Well, guys, thank you so much for joining. We're good. That's it for our May office hours, short, sweet. I hope you enjoyed all of Dr. Zager's insight. And if you have any questions, you're more than welcome to reach out to our Paloma team. You can email them at contact@palomahealth.com if you have any questions about your lab results or scheduling or anything like that. If you would like to see Dr. Zager as a patient, again, it is truly dependent on your location and where you live. You can go to our website at palomahealth.com under our doctors section, and you can go ahead and book an appointment with him. You would have to sign up to become a Paloma member, and then you would be able to get access to book an appointment with our providers. And again, if you are not on the app, it's a free download. We have so many resources there, recipes, which I forgot to mention earlier in the day. So if you are on AIP, like I said, or if you just need some gluten-free, maybe dairy-free, egg-free kinds of recipes, we have all of that on there. And yeah, that's it for this month's office hours. We'll be doing another office hours every single month, so stay tuned, get on our newsletter, and you'll hear more from us when we announce our next office hours. Until then, have a great